This whole Zoom phenomenon is relatively new to us at SpedNet, so please bear with us as we work through this. We're so happy to have Dr. Solandy Forte here today to discuss practical ways to help your team measure your child's learning through COVID-19 school closure. To give you some background about Dr. Forte, she is a doctoral level board certified behavior analyst and a licensed social worker. She's also the director of consultation services and community outreach at the Milestone School in Connecticut. She has provided consultation to public school teams and is an adjunct professor for the Institute of Autism and Behavioral Studies at the University of St. Joseph in West Hartford and at the Institute of Behavioral Studies at Endicott College in Beverly, Massachusetts. She's also a board member of SEEK, and if you haven't checked out their website yet, please do so. They're doing some very important work in Connecticut for our kids. Your moderators are Eve Kessler, the founder of SpedNet, Carolina Corrigan, and myself, Janine Kelly. We're hoping to provide you with a couple of key takeaways today. First, that even though schools are closed, parents are still equal partners with their school teams. And as equal partners, we should be really trying to communicate with them on a regular basis. And then secondly, while our children are learning at home, we may not necessarily be able to step into the shoes of their teachers or service providers, but what we can be are the observers of how they're responding to remote learning. And there's so much important information there that we can be sharing with our teams on a regular basis and also providing to them when the kids return to school. So just a couple key points to keep in mind as we go through this. And then a couple key ground rules. Please feel free to ask questions when Dr. Forte is finished. You can access the virtual chat icon at the bottom of your screen, and we'll be moderating the questions as they come through. And then also, any information provided in this webinar by Dr. Forte or the moderators is not intended to be legal or therapeutic advice, and the information and content and materials are really for your general purposes only. The views expressed by the speaker in this webinar and subsequently posted are those of the individual speaker and not necessarily those of SpedNet. So with all that being said, we will welcome with open arms Dr. Solandy Forte.
Thank you. All right, so this Zoom experience for me, I was chatting with the moderators earlier, and I had said that I went through a full-day workshop with a few of my colleagues, and this has now become sort of like the new norm. New norm for us as probably parents, practitioners, clinicians, but also for our kids. And this is sort of like the new norm for some, but not for all. So what I've been invited to talk about today is how we can capture information, capture data, let's just say, right? I'm gonna just throw out a couple, words there. When I say data, it could be a little intimidating, but what I'm talking about is just information, right? We're gathering information so that we can communicate how our kids are doing at home with our providers, with our teachers, with our special educators, because when they have that information, they're able to then adjust to what they're giving us or delivering to our children through distance learning. So a few weeks ago, I joined SEEK. I'm on their board as well. And Julie Swanson and Jennifer Laviano and I got together and we said, all right, we need to develop some kind of form that is not intimidating, that's user-friendly, that's like a diary, right? It's just gonna gather some information so you can best communicate with your team. And we went back and forth as to what do we wanna capture? And we came up with a form that I'm going to share now. And again, this is on the SEEK website. Okay, so I know that Janine had mentioned that before, but let me just share my screen really quick. Okay, all right. So this is the form that we came up with at SEEK. And it's basically a weekly sheet that you can use to track how your child is doing. Now, it's broken up into the different domains on the IEP because, again, this form and all these domains aren't necessarily all on your child's IEP. So keep in mind that you may need to, individualize this form, not use some sections, but really take a look at it and say, how can I use this like a diary, right? Just to collect some information. So we have the 5 different domains. We have, sorry, more than 5: academic, cognitive, social behavioral, communication, gross and fine motor, post-secondary education training, self-help, and then employment, independent living, and I believe there's other. Oh, and I missed health there. So you have all the different domains that you can cross out, delete, or keep if you're going to collect some information in those areas. Now, what I'd like to sort of do is I want to walk you through what I'm doing here, right? So at the way beginning, when you're starting to receive materials for instruction in your home, it could be through video conference consultation. It could be through a virtual classroom like we have right now. That's, oh my goodness, a Google Classroom. And it could also be online supplemental resources. So a bunch of links to different websites so that your child can access for them to do, some schoolwork. Could be teletherapy. Okay, so your providers are actually coming on. They may be using Google Hangouts, or they may be using Zoom to deliver some therapy. And then, at the way beginning, I know that, my child came home with, a Chromebook. He came home with an iPad, and he also came home with some worksheets. He also came home with some curriculum workbooks. He came home with some manipulatives. Others may have received some visuals or some audio instructions, maybe some emails sort of describing exactly what needed to do for you to do. So what I'm trying to get at here is you want to make sure that you capture this information in your tracking sheet, in your weekly tracking sheet. What was the material that was presented or given to my child, right? And most importantly, were they engaged? Were they responsive? Did this work? Did it not work? What did not work about it? When you start collecting those details, you're able to have specific, very detailed conversations with your educators. So, for example, in my case, we're finding that face-to-face contact on the screen through Zoom, our child is more responsive, okay? But if you have materials that are send him to a website that then he has to log on and take those extra steps, and then he's timed, it's a very, very difficult experience that we all have to endure. Okay. Just like, I was sharing with the moderators this morning that I had a huge hiccup this morning, trying to get everyone started before I was able to jump on this webinar. So when we're looking at this form here, I'm just going to look at the academic and cognitive domain, and I'm going to bring up a sample. This is absolutely just completely pretend. This is not my kid. This is totally pretend, but I'm bringing up the sample so you know sort of how casually you can write some of these, this information. So academic cognitive, at the way beginning, I said, well, let me collect a little bit of baseline data. I have for baseline that he was given reading worksheet with high frequency words. So, right, so I'm going to be typing here and I'm going to say high frequency words. He was able to read 8 out of 10 words that were presented independently. And I was really excited about it. And in talking to the teacher the following week, she had said to me, well, I sent a whole bunch of mastered stuff home. And I said, great, because I don't know if I could have handled having to teach him anything new, especially when we didn't know how we were going to actually execute the instruction at home. So then I put, instruction and services, more detail as to what was provided. Well, worksheets combined with online reading materials. Make sure, now this is a note to myself. So I wrote, make sure you communicate with the special education teacher if there are any other materials or websites he can access at school independently, because I wanted to know I'm also working from home. I wanted to know, what can he do independently so I can structure his day? Okay. Progress, at this point, I was collecting some baseline data, right? I don't know what the progress is going to look like. Maybe the following week, I don't collect baseline data anymore because I've already have information about baseline. This gets completely removed the following week, and now I'm just dealing with progress, right? So other information. Well, let's pretend, right? I'm just sort of writing down information. Responded better to the material presented online. Okay, so not necessarily the worksheets in this case. Was excited to see pictures that were paired with words on the screen. Okay, all right, so that's information I can communicate with my educators. And then overall over here, how did your child respond to instruction and services this week? Well, was excited to see all his providers on the screen, struggled with math that was timed, refused to participate in extra math online application. Okay, so these are just sort of some quick examples, right, of some language that I can put. These are notes for me to communicate with my providers. This is just another example. So social and behavioral. In this case, baseline does not apply because I'm now in the second week, let's say, and I'm just looking at progress. So instructions that were instruction or services, word fluency program online. Okay, all right, that was something that was given to him. And progress, let's see, what did I write here? This was something that I used for Seek, so I was writing it in the moment. Slight increase in refusal to participate in specifically reading fluency activities. On Tuesday, we attempted 5 times to complete assigned activity, word fluency specifically, and all were refusals, right? Then over here, how did my child do? How did he respond? Saw an increase in refusal behavior. Asked teacher if she uses any specific strategies to help with this. Okay. So basically, I'm going to go through this on a weekly basis and take notes. Make this my form. Okay. For those parents that feel that capturing some other information, like maybe if their child completed the assignment completely independent at an independent level, or maybe they required review or explanation of an assignment, you want to take note of that. What if the child required, let's say 2 to 3 prompts to complete the assignment, or if they required more than 3 prompts to complete the assignment, or if they refused altogether and you just couldn't get through it. So those are things that you sort of want to capture when you're collecting some of this information. Now, I do see a few chats that have come in. I'm not sure if you all have any questions, but this form is also available in Spanish on the Seek website. So I also wanted to share that. It is available. I have found it to be very helpful when communicating with my providers and adjusting what the lesson plans need to look like, because honestly, I want my child to be as independent as possible and be happy when completing this, not necessarily, it to be a struggle to get him out of his beanbag to actually sit in front of the computer. And I think that over time, this will get easier and easier for our kids if we obviously are working with the school team to provide them with structure, and also understand that we can be flexible with what is being assigned to our students, our kids in our homes. So do we have any questions from the audience yet?
We've only had a little bit on Seek's website. We don't have any particular questions right now, but if you guys have any questions, please write them in the Q&A, and Dr. Forte will answer.
Okay. I will also take a look and see some other items that folks have asked me about. Is I know that there are some families that, well, one clinician that I was talking to yesterday and a family member who was saying that their child was actually more responsive to the distance learning that they were receiving. And this information that they were gathering was, they felt was actually going to help when they returned to school. Because their child was actually responding better to the online instruction. So that's something that a family member and a clinician were talking to me about yesterday. She had said to me, "Can we do more of this? You know, this is amazing. I'm not seeing any problem behavior. I'm not seeing any refusals. I'm actually seeing more engagement." So that's information that you can capture on this tracking sheet as well. So don't limit it to what is not working. Please include what is working, so that in the future we have information for how to better individualize either a child's IEP or really dive into different modes of instruction. Okay, this is almost like our time to explore and really get to see what our kids are able to do. And in other cases, I've been on phone calls and with families and clinicians where it's breaking my heart, you know, and I'm having a hard time sort of keeping my emotions in check when I'm on Zoom. Because some of our kids are absolutely not responsive to this mode. So I have a question here. When should we share this data with the school team? Day to day? Okay, so I'm suggesting that you collect this information on a weekly basis. And I'm suggesting that you reach out to your team when there is a change that you feel needs to happen or information that you would like to share. That could be done through a simple email. It could be done through scheduling a 15-minute call with the teacher. Now, keep in mind that if they don't know that you're struggling with something, they're going to continue to provide you with the same material over and over again because they don't know what is happening. As I'm also working with providers and clinicians and teachers, and I'm always thinking, imagine, being at home, working at home, working your tail off to really prepare these materials. It takes hours and hours for teachers to actually do this, find materials that, are online. And then all of a sudden you've done this for weeks and no one's communicated with me that the kid's not responsive, right? So it's better to tell them right away if you can, okay? We also have, we had another question, but it went away.
It was where on the SEEK website was the forms. So I just posted where under what tab it was.
Okay, all right, great. So just think about it and use it as a communication tool. That's the best advice that I can give. I use it as a communication tool, and I feel that my team has been responsive of changing, the instruction, the amount of work, the lesson plans. They've also helped me to prioritize. So don't do what was it? It's not that they told me not to do something on the lesson plan, but what they did tell me is, why don't you focus on sort of the easier things to do, get through those, and then sort of intersperse some of those more difficult tasks throughout your day. And I said, well, that totally makes sense. As a behavior analyst, I say, well, build behavioral momentum, right? So I said, well, that totally makes sense. I think that parents are experiencing a lot of pressure right now, not from the school teams, from really the assignments that are being given. And it's almost like you see it as your assignment. I have to complete this because I'm the teacher right now, and I'm sort of given this a lesson plan of items that I have to get through. So I think that as families and caregivers and parents, we're the ones that are putting pressure on ourselves to get this. But if you use this as a communication tool, I think that your educators and providers will help you to prioritize. They won't tell you that, to forget about stuff. They will just, help you to sort of prioritize. Any other thoughts or comments, questions? No?
I have a question for you. Oh, it looks like someone else popped up a question, so I'll hold mine.
Okay, so it says our school just issued a progress report and everything is satisfactory, progress or other, meaning that due to COVID goal was not addressed. Is that okay? I cannot answer that question necessarily for your individual case. If that occurred to me, I would reach out and I would have a conversation with my school team and say, what does that actually mean? How are we determining that he's making or she's making satisfactory progress? Can you tell me a little bit about what helped you arrive at recording satisfactory progress? What data have you collected throughout this period of time when school has been closed? Are you just using the information that was obtained while they were in school, or are you, using the time that they've been out of school, receiving distance learning, or a combination of both? Can you help me understand that a little better? And then that's when you will be able to answer the question, is that okay? Is it okay for you, or is it not okay for you? Okay, but having those conversations and asking those questions will help you arrive to to feeling if that's something that you want, to be okay with. Janine, you had said that you had a question?
Yeah, I just wanted to ask whether parents can use the form to kind of adapt it to their own methodology based on the dynamics in their own house. So could they,
oh my goodness,
journal or?
Absolutely, absolutely. I'm telling you, when I must have gone through 3 iterations of data sheets before we arrived at something that kind of looked like, sort of like you're just sort of like a diary, right? You're just sort of taking notes and writing, what's happening, what we're using. I must have had tons of check boxes, but we wanted to develop something that was sort of could be used universally. And that's why we left it a little more open to for folks to write down information rather than very specific to diagnosis or individual needs, because each of us know what information. And the other thing is that I forgot to mention is take a look at your IEP. Okay, take a look at your IEP and ask, what goal and objective is this assignment targeting? If you can't answer that, ask your team. Ask your team. Sometimes it's true, right? We don't know what materials are being presented and what it's for. Some of them are obvious, right? And others are not so obvious, okay? And some of them can be sort of mixed up. Is this what's going on in the regular education classroom, or is this the special education instruction, specialized instruction that he should be receiving for reading? So ask, okay? Because if there's something that's specific to and specifically tied to that goal and objective, you can write it down on there. This targeted, right? Goal, I don't know if we have it on there actually, but goal, it's not on there, but honestly, I would put something like, targeting goal 3, objective 2. Okay, that specific assignment. And that's how I would, oh, you know what? I'm not even screen sharing, so you didn't see what I did. So I am going to screen share so you can see really quick. So I typed in here, okay, targeting goal G3, objective O2. That specific time, okay? And maybe it's multiple objectives, you know, because sometimes some assignments can target multiple goals and objectives. Write it down. This is also an opportunity for us to learn how our IEP goals and objectives, our kids' IEP goals and objectives are being targeted. Okay, I don't see any other questions coming in or comments, but again, the form is on the SEEK website, both in English and in Spanish. You can adjust this sheet. You can recreate it to make it your own. Okay. Carolina, Janine.
All right. Is this it? Does anybody have any last questions?
This has been really great.
Yeah.
Thank you so much, Dr. Forte. Really important for parents and teams really to keep communicating with each other, and the information that parents are able to gather at home is really important to the team, as you said, Dr. Forte, because it allows the team to understand how things are going really on a weekly basis with the child's learning at home. And it's also going to be helpful when everybody returns back to school to kind of assess how much the child has learned and whether anything needs to be tweaked when they get back to school. So.
Right.
We had one question just come in. Do you see that, Dr. Forte? Or do you want me to read it?
I see it now. Okay, so my son, 8 years old, doesn't like writing. Some days he says he will complete his writing assignment, write about volcanoes. The next day he does not want to write and shuts down. He tells me to stop once I mention it. I ask him what part of writing he doesn't like. He says most of it. I like to write comic books. However, this is what he's saying now. I like to write comic books. However, he doesn't do that either. His attention goes to what he likes, which are fun things. Do I communicate this to the teachers? Absolutely. Absolutely. What is it about writing? Also take a look at the goals and objectives that he has for writing. Get really familiar with that, and then ask your teachers. I'm telling you, a 15-minute phone call can go a long way. I'm very thankful for those 15-minute phone calls that I honestly, that either I've had to ask for or they have completely initiated, because I have communicated through email and they immediately say, all right, let's get on the phone. Let's sort of walk through what's happening here. And those are very much appreciated. Teachers more than ever right now, they just want our kids to, not be frustrated. They want our kids to still continue to experience learning in a positive, fun way, and they will get on the phone with you and talk to you about how that they can make that happen. Keep in mind, our teachers are working and our providers really, really hard to make sure that they're getting some of that information out to us. So this is just one other way to communicate. So yes, to answer that question, absolutely communicate with your teachers. Let's see. We have the same problem. My son is 6 and in kindergarten, and we have refusal every time with writing. So this person is basically sharing, the difficulties of writing. I'm there with you. That's probably that's the last thing on my priority list. I actually save it for day 2. I don't like doing it with him. So I share that struggle.
So Dr. Forte, there is one more question about where specifically on the Seek site families can find your prior presentation and the forms.
So the other option is for you to go on Facebook. It's Special Education Equity for Kids Facebook page. If you follow and like the page, you can see the town halls that they have given so far. They're all recorded, they're all up there. And on the Seek page, special education, hold on one second. I will tell you where it is.
I think it's under the tab school closure. That's what I found it.
It's under the tab school closure. And what you will find is you will find the downloadable data collection form. So it says English version. What I will do is I will copy this link here and I will add it to the chat box. Oh, to everyone. I think what's happening, Eve is, and Carolina, is that you're responding only to the panelists so that the attendees aren't seeing it.
Oh, I thought I changed that.
So all panelists and attendees, now they can actually see where it is.
Yeah, Eve, you need to change your setting. Or I can probably change it for you.
There we go. Okay, so there is the actual link to where those are. Again, they're both in English and in Spanish. Okay. We have a couple chats and coming in just of people basically saying that, you know, they will now reach out to their teachers because, you know, they're experiencing some moments of frustration with the schoolwork, and I think this quick talk has encouraged people to say, you know what, it's okay to reach out.
That's great. Yeah, the teams are really working hard, and you are at home with your child. So if you don't necessarily report to them the good and the bad and, you know, everything in between, they don't know. They may not necessarily know how your child is doing. So definitely report what's working and what's not working and get into a dialogue with your team. They're there to support you. So
Absolutely.
Yeah.
Okay.
I think we're.
thank you so much.
All right.
so much.
Thank you all for inviting me, and I wish everyone you know, health, stay safe out there, and I am sure we'll be going back to school soon, but with the new norm.
Yeah. Yeah. Right.
we have all learned a lot from this process, and we are so much better for it. So
Thank
All
you,
right.
Dr. Forte.
Okay.
Thank you so much.
Thank you. All right.
Thank you.
Bye.
Bye, guys.